So hello to all of you. So hello to all of you. So welcome all. We are starting with the first professional courses today. So this is just an introductory lecture for the first year students. We will be starting with the actual session from 8:30 today. That's the first lecture of the first professional course of anatomy. Okay. So I'm Dr. Pradeep Pawar. I'm a professor of anatomy and I've got a vast experience of teaching anatomy for the undergraduates and the postgraduate students for all the entrance examinations. And I've mentored many students to get their PG seat. Okay, so topic for today is the axilla. I've just selected the axilla topic today. So you get an idea, you get an orientation, you get an understanding to how the teaching is and how the interface is. You'll be getting notes and we'll be covering this anatomy extensively over a period of 8 months, 6 to 8 months, alternate days in the evenings. Okay, so here we are starting with the axilla. So just a topic I've selected for you, that's the axilla. Here we are, we start. Tell me now, this area that you're looking at, this is the axilla. Okay, this is the axilla. So now, yes. So what are the boundaries of axilla? The muscles which will be beginning from here, beginning from the sternum and the costal cartilages and going towards the humerus, what boundary are they going to form? That means axilla will have boundaries, it will have various boundaries. So what is this wall of the axilla in front? This is the anterior wall. The wall behind is known as the posterior wall. So you have an anterior wall for the axilla, you have a posterior wall, you'll be having a medial wall, and you'll be having a lateral wall for the axilla, lateral wall. So the muscles which are beginning from the sternum and the costal cartilages and going towards the humerus, what are they going to form? They are going to form the anterior wall of axilla, anterior wall. So now see this. Identify this muscle here. This muscle which begins from the anterior border of the medial 2/3 of the clavicle. What is this muscle which begins from the clavicle? Anterior borders, medial 2/3. Yes, be interactive. Your answer, so it will be easy for you to understand. What is this muscle which begins from the clavicle? Yes, this is the pectoralis major. So the pectoralis major begins from the medial 2/3 of the clavicle. It begins from the manubrum and the body of the sternum. It begins from the 2nd to 6th costal cartilages. And there's a muscle of the abdomen here which gives origin to pectoralis major. What muscle of the abdomen is this? It's a paper-like, that's an aponeurosis, and that's the external oblique aponeurosis. So this is the pectoralis major muscle. Pectoralis major arises from the medial 2/3 of the clavicle, the manubrum and the body of the sternum, the 2nd to 6th costal cartilages and the external oblique aponeurosis. Now this entire muscle comes and gets inserted on the lateral lip of the bicipital groove. So this is a big muscle. Now we remove the pectoralis major and now we find a muscle which begins from the 3rd, the 4th and the 5th ribs, 3rd, 4th, 5th ribs, and it is inserted into the coracoid process of scapula. Yes, this muscle which lies below the pectoralis major, which begins from 3rd, 4th, 5th ribs and is inserted into the coracoid process of scapula. If you can identify this muscle for me, what is this muscle? It's below the pectoralis major. It's a small muscle of the pectoral region, and this is the pectoralis minor. Pectoralis minor begins from the 3rd, 4th, 5th ribs and inserted into the coracoid process of the scapula. Very good. And now, tell me, one moment, I'll just clear this for you. Now see this. Now, this is the first rib. Okay, what is this? You tell me. What is this? This is the first costal cartilage. First costal cartilage. The first costal cartilage will be followed by the first rib. This I'm drawing as the costal cartilage. This is the costal cartilage, and that's the first rib. What do you call this junction as? The junction of the costal cartilage and the rib. Answer this. What do you call this junction as? The first costochondral junction. This is what we call as the first costochondral junction, and this first costochondral junction gives origin to a muscle here, and this muscle who's lying above the first rib? Tell me, who's lying above the first rib? That's the clavicle. So this is a muscle which begins from the first costochondral junction, and this muscle is inserted on the under surface of the clavicle, on the inferior surface of the clavicle, and this is what we call as the subclavius muscle. Subclavius. Yes, very good. So that's the costochondral junction. From the first costochondral junction, what begins is the subclavius muscle, and this subclavius muscle is inserted on the inferior surface of the clavicle, therefore known as subclavius. Okay, so now we've got three muscles here. One is the pectoralis major, the second is the pectoralis minor, and the third one is the subclavius. Okay, together these three muscles are going to form what for the axilla? It is going to form the anterior wall of the axilla. You're understanding this? So this wall that you're holding here of the axilla, this is the anterior wall of axilla, and this would be formed by pectoralis major, pectoralis minor, and the subclavius muscle. Subclavius. Is this clear? Following this? Are you all able to understand? Are you all able to follow this? So this is about the anterior wall of axilla. Just have a look at this muscle. Identify this. This is what I was telling you. What is this muscle? Beginning from the second, third, and fourth ribs, and it is inserted on the coracoid process. Okay, that's the pectoralis minor. And here, that's the muscle here. What is this muscle? Inserted on the inferior surface of clavicle. That's the subclavius. Okay, so this becomes the anterior wall of axilla. Okay, just answer whatever you know, you answer, so it will be easy for you to understand. Okay, here we are now. Tell me, what is this surface of the scapula? Where are you looking this from? Be interactive and answer, so it will be easy for you to understand. Chalo, what is this aspect of the scapula? Where are we looking the scapula from? There are two sides for the scapula. One you're looking from front, one you're looking from back. We also call this as costal, anterior, and posterior, or dorsal. Tell me, what is this aspect? Anterior aspect. Very good, Dipti. That's the anterior aspect, or the anterior surface, also known as the costal surface, right? Because this part of the scapula will lie on the ribs, and this is therefore known as the costal surface. Excellent. What is this bone? What is this bone? Sorry, what is this bone that you're looking at? Yes, from the costal surface, you see, you will be looking at the coracoid process, right? That's the coracoid process. And the same, if you look from the dorsal aspect, if you look the scapula from the dorsal aspect, you see the spine and you see the acromion process, right? You see the spine and the acromion. So that's the dorsal, and this is the costal surface. Excellent. Now, costal surface. What is this fossa known as? Like, you know, our ancestors used to walk on four legs. They walk on four legs. So the scapula would be like this in animals. Now, this surface of the scapula faces the ground. It faces the ground. So this is also known as inferior surface of scapula. And the muscle which begins from this inferior surface is therefore known as below. Inferior. What would this muscle be known as? You can answer this. This muscle is therefore known as the subscapularis. Very good. This is the subscapular fossa. Now we have started walking on two legs. Our scapula has become like this, but still we call this as the subscapularis muscle here. That's the subscapularis muscle. Okay. So costal surface, this is the subscapular fossa, and this muscle is the subscapularis. This is the medial border. This is the costal surface, medial border, and there's a muscle which begins from the ribs and gets inserted into this medial border on the costal surface. And what is this muscle? I've not told you this, I'm just asking you. This muscle is going to pull the scapula forwards, and that's the serratus anterior. So the costal surface This is the subscapular fossa. The muscle is subscapularis, and here is the attachment of serratus anterior. Fine, fine. I just want you to understand the subscapularis for the moment. Now see this slide and tell me, what is this aspect of the scapula? Chalo, what is this aspect? Where are we looking this from? This we're looking from back side, right? This we're looking from back side. And what is this big muscle? Look at this big muscle here. Look at this big muscle. This big muscle begins from the iliac crest. It begins from the thoracic, the lumbar, and the sacral vertebrae. The thoracic, the lumbar, and the sacral vertebrae, it begins from the iliac crest. This is a muscle of the back, and this muscle is going anterior. It goes in front and gets inserted into the floor of the bicipital groove, right? It's a muscle of the back, but it is coming anterior, and this is known as the Latissimus dorsi. It's a very big muscle. This is the Latissimus dorsi, right? So that's the Latissimus dorsi. Now coming to this, what is this surface of the scapula? That's the dorsal surface of the scapula. That's the spine of the scapula. What is this fossa known as? This is the supraspinous fossa. Okay, and this is known as the infraspinous fossa. Right, that's the supraspinous fossa, and that's the infraspinous fossa. What is the muscle which begins from here? That's the supraspinatus. And what is the muscle which begins from here? That's the infraspinatus. So this would be the supraspinatus, this would be the infraspinatus. I'm just telling you all this. Tell me, dorsal aspect, what is this border here? What is this border? This is the lateral border of the scapula. There are two muscles which arise from here. Here, if you can just tell me, what would this muscle be? This muscle which arises from here. Here. From above, and this is from below. So dorsal aspect, lateral border, there's a muscle which arises from here, and this is what we call as, yes, answer. What is this? Teres minor. Excellent. That's teres minor, and this is the teres major. That's the teres major. Now this teres major is going in front. It goes in front. It comes from behind. It comes forwards, and it gets inserted on the medial lip of the bicipital groove. On the medial lip of the bicipital groove. So just quickly, just tell me, what was the muscle attached to the lateral lip of the bicipital groove? Lateral lip, muscle attached to the lateral lip. Yes. Lateral lip of the intertubercular sulcus or the bicipital groove. That was Pectoralis Major. Very good, Pectoralis Major. And what is the muscle attached to the medial lip of the bicipital groove? That's the teres major. And where is this Latissimus dorsi? Inserted in the floor of the bicipital groove. Latissimus dorsi lies in the floor of the bicipital groove. Fine. So that's teres major. Very good. And what would this muscle be which would begin from here? What would this muscle be which would begin from here? One moment. What would this muscle be? This would be the teres minor. If you can tell me, where is the insertion of teres minor? Where is the insertion of teres minor? This teres minor is inserted on the greater tubercle. This teres minor is inserted on the greater tubercle, like this, teres minor. So if you're looking from behind, what is this muscle? This is teres minor. What is this muscle? That's teres major. And what is this muscle? This is the Latissimus dorsi. Okay, this is the Latissimus dorsi. Now suppose if I remove this teres minor, look, one moment. If I remove this teres minor, what do I see? I find a muscle here, and this muscle is filling this gap. I've removed the teres minor. This is slightly difficult, just understand. I've removed the teres minor for you, and I find this muscle. This muscle is present on the costal surface. It is present on anterior. It's on the costal surface. The moment I remove the teres minor, I find this muscle, and this muscle is present on the costal surface. What is that muscle? That is the subscapularis. If you're looking from backside, you're not going to see the subscapularis. Yes, Wasim, just wait. What is this muscle? This is the subscapularis. Normally, we are not able to see the subscapularis, right? Normally, we are not able to see the subscapularis because what is going to cover the subscapularis from behind? This is the teres minor. Teres minor covers the subscapularis from behind. I remove the teres minor. What do I see now? The subscapularis. Okay, you'll understand. Just have a look. One moment. Yes, Wasim, I'll tell you. Just one moment. Just wait. So now you tell me, what is this surface of the scapula? That's the costal surface. What is this muscle here? This is the subscapularis. That's the subscapularis. Now just think and tell me, if I draw a muscle here for you at the lower border of the subscapularis, what would this muscle be? This muscle is coming from backside. This muscle is coming from backside and getting inserted on the medial lip of the bicipital groove. Answer. This muscle is coming from the dorsal aspect of the scapula, lateral border, coming and getting inserted on the medial lip of the bicipital groove. Answer. Who's this muscle? What is this muscle? It's inserted on the medial lip of the bicipital groove. That's the teres major, and teres major. It's not teres minor. It's teres major. And if I draw another muscle for you, coming from here, coming from behind, and getting inserted into the floor of the bicipital groove. Tell me, what is this muscle? What is this muscle? This is going to be the latissimus dorsi. That means if I look from front, I'm looking from front. I've removed the anterior wall of axilla. And what am I looking at? I'm looking at these three muscles. This is the first muscle, that's the second muscle, and that's the third muscle. And these three muscles are going to form what? Answer. What are these three muscles going to form? For the axilla. Yes. What are these three muscles going to form for the axilla? Yes. We've opened the anterior wall of the axilla, and now what we are seeing, these three muscles, these are going to form the posterior wall of axilla. Yes, very good. These are going to form the posterior wall. How anterior wall, my child? How anterior wall? This is going to form the posterior wall of axilla. Anterior wall of axilla is formed by what? Pectoralis major, Pectoralis minor, and subclavius, right? Now we have opened the anterior wall, you've removed the anterior wall, and this is what you're going to see behind. You'll be seeing the subscapularis, you'll be seeing the teres major and the latissimus dorsi, and this is going to form what? The posterior wall of axilla. Yes, the posterior wall of axilla. Yes, Janish, I'll tell you later. Every day you're asking me this. So if I have to see the teres minor in this, tell me, where is the teres minor in this? Where is the teres minor? Where is the teres minor in this slide? If I have to see the teres minor, what muscle have I to reflect? Yes, if I have to see the teres minor, which muscle have I to reflect? Answer. Which muscle should I reflect? Yes. Answer. I'm looking at the screen. If I have to see the teres minor, I have to reflect a muscle here. Only then I'll be able to see the teres minor. Which muscle have I to reflect? Are you following this? I have to remove this muscle. No, not 3, my child. Not 3. I have to open the subscapularis. If I remove the subscapularis muscle from here, behind the subscapularis would lie what? Teres minor. Behind the subscapularis would lie the teres minor. Are you following this? I have to remove the subscapularis. Then behind the subscapularis would lie the teres minor. It is slightly difficult to understand this. One moment. Have a look at this now. I'll explain you once again here. Look at this. One moment. See this slide. See this slide. It will be clear. See to it that all these things are clear to you. Huh? Look what I'm telling. This is the dorsal surface of the scapula, right? This is the dorsal surface. What is this muscle? This is the latissimus dorsi. What is this muscle? That's the teres major. And what would this muscle be here? You're looking from backside. Yes, what are these muscles? What is this muscle above the teres major? That's the teres minor. So if you're looking from backside, you'll see the teres minor, you'll see the teres major, and you will see the latissimus dorsi. Okay, and the latissimus dorsi. Now in this slide, where is the subscapularis muscle? In this, if I have to see the subscapularis, what am I supposed to do? I am supposed to reflect the teres minor. I just have to remove the teres minor. Right in front of teres minor, what do I see now? Right in front of teres minor, I see the subscapularis. Understanding now? Is this clear to all of you? Yes, I see subscapularis here, but subscapularis is present where? On the Costal surface, it's in front, it's anterior. That would be the subscapularis. Is this clear to all of you? If it is not, you tell me. I'll explain once again. If it is not clear, one moment, I'll explain once again to you. See the slide. Just get oriented to what is dorsal, what is costal aspect. It will be clear to you. Look, once again. Look here, once again. Tell me, what is this surface of the scapula? What is this surface of the scapula? Costal. That's a costal surface of scapula. What is this muscle? This is the subscapularis. At the lower border of the subscapularis, what is this muscle which is seen here, which is inserted on the medial lip of the bicipital groove? This would be the teres major, right? At the lower border of teres major, I'll be finding one more muscle at the lower border of teres major, and this muscle is inserted into the floor of the bicipital groove. What is this muscle going to be? This would be the Latissimus Dorsi. Now, perfect. So all these muscles are going to form the posterior wall of axilla. See, posterior wall, how will you see? You open the anterior wall, and then from front, you're looking at the posterior wall. Then from front, you're looking at the posterior wall. And that is how the posterior wall would be formed by subscapularis, teres major, and the Latissimus Dorsi. And again, I'm telling you, if I have to see the teres minor in this case, if I have to see the teres minor, I just have to cut the subscapularis. Right behind the subscapularis is going to be teres minor. Is this clear to all of you? Yes, just tell me, is this clear? Okay, fine. Now you tell me, what is this wall of the axilla? What is this wall of the axilla? These are the ribs. So this is going to be the medial wall of axilla. The medial wall of axilla would be formed by the ribs. And what is this muscle which arises from the ribs as digitations here? What is this muscle which arises as digitations? Yes, what is this? This is the serratus anterior. That's the serratus anterior. Okay. So the serratus anterior and the ribs, they form the medial wall of axilla. The ribs and the serratus anterior, they form the medial wall of axilla. Just look at the slide once again. See the slide once again. I'll magnify this for you and it will be clear then. Okay. See this. Coming back to the axilla, what is this area? This area is the axilla. This is our axilla. So what are the boundaries of axilla? It will have an anterior wall, it will have a posterior wall, it will have a medial wall and a lateral wall. So the anterior wall here, this here would be the anterior wall formed by three muscles, the Pectoralis Major, the Pectoralis Minor and the Subclavius. They form the anterior wall. The posterior wall is formed by three muscles. One, the subscapularis, the teres major and the Latissimus Dorsi. Subscapularis, teres major and the Latissimus Dorsi. What is this wall going to be? This is going to be the medial wall, and the medial wall would be formed by the ribs and the serratus anterior. And the lateral wall would be formed by the humerus. And there's a muscle which begins from the coracoid process to the humerus. What do you call this muscle as? From the coracoid process to the humerus. That is forming the lateral wall. Answer. So lateral wall would be formed by the humerus and a muscle which begins from the coracoid process to the humerus. Just guess that. What will that muscle be from the coracoid process to the humerus? Coracobrachialis. That muscle is going to be the coracobrachialis, right? Coracobrachialis. So lateral wall would be formed with the humerus and the coracobrachialis. Okay, perfect. Now there's one last boundary left for the axilla. I'll make a slide for you. See if you can understand this slide. This is the manubrium sterni. That's the body of the sternum here. That's the body of the sternum. This is the clavicle here. That's the clavicle. From behind, this is going to be the scapula. From behind, that's the scapula. This is the first rib for you. That's the first rib. And that's the humerus here. Okay, I'll start. These are the cervical vertebrae. Now have a look at this and be clear. This is it. This area is the axilla, which I've drawn for you. This is the axilla. So the muscle starting from the sternum going to the humerus, they form the anterior wall. The muscle coming from the scapula to the humerus, they form the posterior wall. These are the ribs. So this would be the medial wall, which will be formed by the ribs and the serratus anterior, and the lateral wall would be formed by the humerus and the coracobrachialis. Okay, now what is this for the axilla? This. What is this area for the axilla? And this is what we call as the apex of the axilla. This is what we call as the apex of the axilla. Like, see, if any structure has to come into the axilla, there's only one way. There's only one way to come into the axilla, and that is the apex. Apex. That's the apex of the axilla. Or this is also known as, what is this above the clavicle? What is this area above the clavicle? Yes, what is this area? That's the neck. And the neck is also known as the cervix. So from the neck into the axilla, the structure would be coming from the neck into the axilla, and this is what we call as the cervico-axillary canal. Cervico-axillary canal, or this is also known as the apex of the axilla. Apex, okay, or the cervico-axillary canal. Now see what enters the axilla through the apex. If you can answer this for me, yes. What is this behind the manubrium? Chalo, start. Answer. What is this behind the manubrium sterni? What is this behind the manubrium sterni? Look, this is so nice. Just understand how does the structure come into the axilla through the apex. To explain that, I'm telling you this. What is this behind the manubrium? That's the arch of aorta. Very good, arch of aorta. And from the arch, what is this artery which begins from the arch here? What's that artery? That's the subclavian artery. Subclavian artery. And the moment subclavian artery crosses the first rib, it is now known as the axillary artery. Yes, it is now known as the axillary artery, and this axillary artery would enter the apex and now come into the axilla. Is this clear? So that's how the axillary artery enters the axilla through the apex, right? So this is first the subclavian artery, and the moment the subclavian crosses the first rib, it is now known as axillary artery. This axillary artery enters the apex and comes into the axilla. Very good. Something else here, something else. This is C5, C6, C7, C8 and T1. What's all this? That's the brachial plexus, and that's how the brachial plexus comes into the axilla through the apex. Are you all following this? So what is the apex? What are the boundaries of the apex? Or the apex is also known as the cervico-axillary canal. Cervico-axillary canal. And who comes in from here? The axillary artery and the brachial plexus. They enter the axilla through the apex. Is this clear? Are you clear about the axilla, the boundaries of the axilla, and the structure, the structure which enter into the axilla? Okay. Right. Is this clear? You must be hearing like this. My voice is not feminine. You must be hearing like this. Just check your earphones. Right? That's it. Now you tell me, what is this? What is this bone below the clavicle, below the lateral 1/3 of the clavicle? What is this bone? Yes, if you can answer this. What is this bone below the lateral 1/3 of the clavicle? That's the coracoid process of scapula. Are you all clear about this? Yes. Are you all clear about the axilla, the boundaries of the axilla, how the structures enter into the axilla? Then I'll proceed. I'll tell you something else. Axillary vein also, no? Axillary vein also. Axillary vein will be there, Tawhid. Axillary vein would be there. Yes. Right. So this is the coracoid process of scapula. Yes, coracoid process of scapula. And what is this muscle here attached to the coracoid process? What is this muscle which begins from the 3rd, 4th and 5th ribs and attached to the coracoid process? Why we normally tell brachial plexus and axillary artery, Tawhid? Because they are enclosed in a common sheath, right? That's the axillary sheath, whereas the vein is not present in the sheath. So whenever we talk about the brachial plexus and the axillary artery. Tawhid, clear? So that's the pectoralis minor. And now you tell me, where is the pectoralis minor? Where is the axillary artery with respect to pectoralis minor? Where is the axillary artery with respect to the pectoralis minor? It's behind the pectoralis minor. It's behind the pectoralis minor, right? And if that's the medial lip and the lateral lip of the bicipital groove, what is this muscle attached to the medial lip of the bicipital groove? What is this muscle attached to the medial lip of the bicipital groove? This is the, yes, this is the teres major. That's the teres major. Very good. And what is this? This is the pectoralis minor. So now, yes. So who's behind, where is the axillary artery lying? The axillary artery is lying behind the pectoralis minor, and this pectoralis minor is going to divide the axillary artery into 3 parts. Okay, so the pectoralis minor divides the axillary artery into 3 parts. Tell me, from its beginning to the muscle, what is this part? That's the first part. From this beginning, that means from the first rib till the muscle, that's the first part. The second part lies behind the muscle, and the third part lies after the muscle. It lies distal to the muscle. Understanding? So axillary artery is divided into 3 parts by the pectoralis minor muscle. And the moment the axillary artery crosses this teres major, what is this artery now known as? This is now known as the brachial artery. Okay, so tell me, axillary artery. So I've done with the axillary artery for you also. Axillary artery, it's a continuation of, answer this now, answer. Axillary artery, it's a continuation of the subclavian artery at, the landmarks are very important for you. Okay, the first Prof students, the landmarks and all are very important for you. So axillary artery is a continuation of the subclavian artery at the outer border of the first rib, right? Now this axillary artery enters the apex. It's a continuation of subclavian artery at the outer border of the first rib. It enters the apex. It comes into the axilla at the lower border of teres major. It is now known as the brachial artery, right? And this axillary artery is divided into 3 parts by pectoralis minor muscle. So there are branches of axillary artery, and how do you remember this? This is very easy. First part, 1 branch. Second part, 2 branches, and third part gives 3 branches. Very easy. First part, 1 branch. Second part, 2 branches, and third part gives 3 branches. So which is the branch from the first part? From the first part, the branch is superior thoracic artery. That's from the first part. From the second part, you get 2 branches. One is the lateral thoracic, and the second one is thoracoacromial artery. And from the third part, you get 3 branches. Out of which 2 arteries are going to wind around the humerus. One winds from front, one winds from back. And tell me, when anything winds around, what do you call this as? Circumflex. Anything winds around, it is known as circumflex. And it winds around what? The humerus. So it is known as the circumflex humeral artery, right? One winds from front, so anterior circumflex humeral. So this is anterior circumflex humeral. From the third part, second branch, posterior circumflex humeral. And the third artery runs on the costal surface of scapula. It runs on the costal surface. Which is the muscle on the costal surface? The subscapularis. And this artery runs on the subscapularis. The artery is therefore known as the subscapular artery. So these are the 3 branches from the third part. And one thing, why we tell the brachial plexus, what Tawhid was asking was very correct. The axillary vein is also there with this, but the brachial plexus and the axillary artery, they are put in a sheath together. And this sheath is known as the axillary sheath. So axillary artery and the brachial plexus, they are present in the axillary sheath. Remember, the vein is not lying in the axillary sheath. The vein is lying outside the axillary sheath. It lies out of the axillary sheath. Is this clear to all of you? Vein is lying outside the axillary sheath. Just see this slide, it will be very clear to you. Okay, just see this slide. This is a very good slide. So the entire concept of axilla will be clear to you. Yes, prevertebral sheath. Venae comitans, my child. That's venae comitans. Venae comitans is a group of veins around an artery. That is venae comitans. Okay. Group of veins around the artery. That is venae comitans. Okay, I'll start with this slide. Just have a look. It's like a rapid fire. You answer, I'll start. Chalo, start. What is this muscle here? What is this muscle which is cut here? Look at this big muscle. We have cut this muscle. It begins from the sternum and the rest of the things, and it comes and gets inserted on the humerus. What is this big muscle? Answer, answer, answer. Pectoralis major. Excellent. That's a pectoralis major. We've cut the pectoralis major. What is this muscle now? It is cut here. Look at this muscle. It is cut here. Going to the coracoid process. What's this? This is the pectoralis minor. This is the pectoralis minor. Okay. So we've cut the pectoralis major. We've cut the pectoralis minor. And tell me now, what is this muscle? What is this muscle below the clavicle, which we have cut? What is this muscle below the clavicle which we have cut? This is the subclavius. That's a subclavius muscle. Okay, below the clavicle, that's a subclavius. That means we have cut the pectoralis major, we've cut the pectoralis minor, we have cut the subclavius. That means what have we cut? What have we removed? What have we opened? So what have we opened now? Answer, answer, answer. We have cut the pectoralis major, we have cut the pectoralis minor, we have cut the subclavius. That means we have opened the anterior wall of axilla. Are you all following this? And now what are we looking into? What are we looking into? We are looking right into the axilla. We are looking into the axilla. So what are these muscles going to form here? This is 1, this is 2, and this is 3. What are these 3 muscles going to form here? These 3 muscles are going to form the posterior wall of axilla. To start with, what is this? What is this? This is the subscapularis, right? That's the subscapularis. What is this? This is the teres major, and that's the latissimus dorsi. The subscapularis, the teres major, and the latissimus dorsi. So this is going to form the posterior wall of axilla, right? And what is this now? What is this artery here? That's the axillary artery, and this is the pectoralis minor muscle here, and this pectoralis minor would divide the axillary artery into 3 parts. From its beginning to the muscle, that's the first part. Behind the muscle, that's the second part, and this would be the third part of the axillary artery. Okay, and who surrounds the axillary artery in the axilla? What is going to surround the axillary artery in the axilla? That's the brachial plexus. And this axillary artery and the brachial plexus are put in a sheath which is known as the axillary sheath. And look at this. What is this? This is the axillary vein. This is the axillary vein. But remember, the vein is not present in the axillary sheath. It is outside the axillary sheath. Tell me, if you correlate this axillary vein with the axillary artery, where is the vein? On which aspect of the artery does the vein lie? Look at the slide and tell me. Where is the vein with respect to the artery? Where is the axillary vein with respect to the artery? Yes, it's medial. Very good. So the vein is lying medially, the artery is lying on the lateral aspect. Okay, so if you compare the vein and the artery is on the lateral aspect, vein is on the medial side, and what surrounds the artery is the brachial plexus. And what is this tendon? What is this tendon? Look, this you should know. This tendon is shiny tendon, and this shining tendon is of, there's only one muscle who becomes very thin, and because it has to get inserted into the bicipital groove, and this is the tendon of latissimus dorsi. Okay, so when you see a shiny tendon like this, this has to be tendon of latissimus dorsi. Is this clear to all of you? Yes, dear students, is this clear to all of you? So this is just an introductory lecture for the first year prof students about the axilla. We are now starting with our plus classes. We'll be now starting with the plus classes for the first year prof students. It will be in the evening from today, from 8:30. The anatomy lectures would start. you can use my code. It's Dr. Pradeep Pawar 7841 to avail a discount. Okay, so that's my code, Dr. Pradeep Pawar 7841 to get a discount. Okay, we are starting with this plus classes. It would be spread over a period of 6 to 8 months. It would be in the evenings on alternate days. And even though different universities follow their own pattern, we will follow standard pattern. Okay, and there will be test, there will be discussions, right? And if you have any doubts, you're free to call. That's my code, and that's my email ID, pawarpradeep@gmail.com. pawarpradeep@gmail.com. Okay, any doubts with respect to the axilla that you have, you can tell me. Any doubts with respect to the axilla? What if you have not understood anything? Yes? Yes, Wasim, you are asking me triangle of auscultation. No? So triangle of auscultation is formed by which muscles, you tell me? Triangle of auscultation is formed by, on the medial side it would be the trapezius muscle, below would be the latissimus dorsi, and on the lateral side would be the medial border of scapula. So medial border of scapula laterally, the trapezius medially, and the base is formed by the latissimus dorsi. Okay, latissimus dorsi, you've got 6th and 7th ribs as the floor. So that becomes the triangle of auscultation. Yes, Vanraj? Thank you. Thank you. Yes, anything else? Anything else if you want to ask about the course, about Unacademy, about our Unacademy Institute? If you have anything to ask, you can ask me. Axillary vein is not present in the axillary sheath, my child. Why? You know why? There's a reason for that. Everything has got a reason. See, because the axillary vein, it brings blood towards the heart. And sometimes the vein brings more blood. So the vein has to distend. The vein has to distend. It needs to have space for distension. It needs to have space for distension. And if you put this in the axillary sheath, if you put the axillary vein in the axillary sheath is a very tense structure. It's a tense structure. So there'll be no place for the vein to distend, right? And that is why the vein is outside the sheath, so that it can dilate. The vein can dilate. Clear, Purvi? But femoral vein, femoral sheath, femoral sheath, femoral vein is present in the femoral sheath. Can you explain this, anyone? Femoral vein is present in the femoral sheath, but there's a special arrangement made there. If you have come to that lower limb, if you have come to the femoral sheath, my dear first Prof students, yes, femoral vein is a content of femoral sheath. Now what? Then how will the femoral vein distend? So in the femoral sheath, medial to the femoral vein, there's an empty space kept there, and the vein can distend. It can use this space. Okay, so that time when you're studying the femoral vein and when you're studying the femoral sheath, a doubt will come to your mind: why is the femoral vein in the femoral sheath when there's no space to distend? But again, nature has taken its own care. On the medial compartment, on the medial side of the femoral vein, there's a space, there's an empty space into which the femoral vein is going to distend. Yes, the dead space. And that is known as the femoral canal. Femoral canal. Okay, right. Anything else? Anything else if you have to ask? So the topics will be divided. From today, we are starting with the plus course on Unacademy for the first year professional students. And for the NEET PG students, tomorrow 9 o'clock, there's a discussion on the MCQs, the clinical MCQs. For the FMG students, there's a discussion at 12 o'clock, 12 in the morning on this MCQ discussion. Now that summative series of anatomy for the FMG students have finished with all my lectures. And now we're starting with the plus lectures for the FMG students also from 17th of May. Yes, same as that of carotid sheath. But carotid sheath has got a space. Yes, my child. Yes. Yash Vikram. Yes, Vikram. What is your doubt? Yes, beta. What's your doubt? Yash Vikram. So I hope everything is clear to you. Okay, so see you then. Register yourself. Use the code to avail a special discount for you. Okay, and if you have any doubts, any concerns about it, you can send a mail, pawarpradeep@gmail.com. Okay, use the proper code, Dr. Pradeep Pawar -7841. Otherwise, the code it doesn't open, or you won't get a discount on that. You can access the free lectures also on the Unacademy platform. I've given some free lectures also. You can have a look at them also. You'll get an idea how the teaching is. The interface is very good. The quality, the video quality, the audio quality is very nice. Okay, so thank you to all of you and good night. Thank you.